Infections in the Eastern Cape are on the rise. The province is currently dealing with over 1,700 active cases. The Nelson Mandela Bay Metro is a hotspot with over 67% of the infections reported in the metro. The Buffalo City Metro and Sarah Baartman district are also areas of concern. Hospitals in the public and private sector are under pressure. SABC News reporter Lerato Fekisi has more.
Well, the active cases in the Eastern Cape are now sitting currently just over 2,500. The majority of those are coming from the Nelson Mandela Bay Metro, over just 1,600. We've just had an interesting conversation with the district manager, Dalinda Force, and she was saying, despite what we are hearing in the media, our hospitals are currently not under strain, especially the public hospitals, but it is the private hospitals that are currently feeling a bit pinch of the strain of COVID-19 cases. But joining us this morning is Dr. Mthandeki, who is the acting CEO of Listing Hospital, to give us a brief overview of how things are looking in the Eastern Cape, especially in the NMB, which has now currently being identified as a problem area in terms of COVID-19 stats. Dr. Thomas, let's just first talk about the overall picture of the Eastern Cape. There are so many reports coming out that our hospitals are under strain, but in terms of the Eastern Cape, how are we looking stats-wise, and also which districts would you say are currently a concern?
Yeah, I think now it's common knowledge that the numbers are going up, and PCM for now is still in the lead, and Nelson Mandela Metro is picking up very, very, very fast. And in terms of inactive cases. The only thing about Eastern Cape, I think in terms of preparedness, the province is very much well prepared, to deal with the third wave. However, there are other broader contextual issues, because we may be prepared in terms of beds and oxygen. But the one critical element in the preparedness is the human resource factor. We must all understand this is a third wave, so the fatigue levels are very high among the staff members. And also the issues of emotional effects of the previous two waves, where we've lost a lot of our colleagues. So in terms of the morale and the energy, there is a little bit of concern in that kind of aspect. So we all need to understand that it takes more than a bed and oxygen now to handle the third wave.
Just speaking about the beds, going back to the second wave, there was concern about bed availability because there was such an influx of people going into hospitals. Now the third wave, as we see in Johannesburg, is 3 times more than what it was in the second wave. Obviously, we're still anticipating such a not to shift of that bad in the Nelson Mandela Bay Metro. But in terms of preparedness now, because obviously the second wave was a learning curve for the Eastern Cape, what are we going to do better now as we prepare for this anticipated third wave?
We've done a lot of work together with the Department of Public Works and Infrastructure to actually commission additional beds in the metro, as we have done also across the province. And those beds, in my view, will be adequate in terms of handling the third wave. However, it can never be adequate if the behavior in society does not come into play, so that people make sure that the rates of infection actually reduce significantly. No amount of infrastructure will be able to handle that if the non-pharmaceutical intervention are not adhered to by society, and the level 3 restrictions as put on by the president are not observed by society. So our appeal remains to the community: please adhere to level 3 restrictions and to non-pharmaceutical interventions. Wear your mask or wash your hands, maintain a social distance. And we also want to encourage people now to start going to vaccinate as another mitigating element to the whole intervention of the third wave.
And then speaking about the vaccination, just how far are we? I know that Darlene was saying earlier on that we're not really hitting our target, especially in terms of the people over 60, various factors contributing to that. But in terms of vaccination, how are we doing as a district and also as the Eastern Cape?
In terms of frontline workers, we're not doing badly. We have not yet that 60% target, but we're pretty close. So we should be about 48 to 52 now on the frontline workers. We still encourage our workers to come and take up vaccination. The vaccines are safe. We are concerned, and we do pay attention to their various concerns. There's a lot going around about vaccination safety and everything else and their side effects. We are dealing with those. There's a matter of genuine concern. But we're encouraging more and more people, especially the frontline workers, to start to take the vaccine. They are very critical to the whole fight against the third wave. As you know that in the next few days we'll be starting to do Department of Basic Education employees. They'll be starting the vaccination, but we are encouraging people to do that. We are concerned, even the elderly people, even in places like Nelson Mandela Metro, we're not yet close to the target. We're at 45% of registration, but we're around 19-20% of the people who have already vaccinated. We need to scale that up and try and accelerate that in the midst. So, because the vaccination is an important arm of our intervention to the COVID-19 pandemic.
Well, that was Dr. Kimnash, the acting CEO of Livingston Hospital, just saying that as a department they have put all hands on desk and are certain that they are ready to really help those who will be going to the various hospitals. They have increased resources, but also he was saying an interesting factor was that we could have enough beds and ventilators, but the staff morale, which is obviously quite exhausted from the second wave, also needs to be encouraged and motivated as the third wave comes. But above all, saying that in the end it's the behavioral patterns of every single person in the country and every person in the Eastern Cape that will determine the extent of the third wave. And we're saying simple things that we must keep on doing, which is covering up, wearing a mask, sanitizing your hand, social distancing, ventilating closed areas. And when people do that, the third wave is anticipated won't be as bad as it is anticipated to be. For now, let's go back to the studio.